Breast cancer is the most common type of cancer for women of reproductive age, and improvements in cancer treatments have resulted in dramatically improved survival rates for cancer patients. Cancer treatments, including surgical removal of reproductive organs, chemotherapy, radiation, can all have a major impact on fertility. For men, this may impact their sperm concentration or motility. For women, cancer treatments can harm eggs or reproductive organs. They can even cause premature ovarian failure for women. For some patients, the effect of cancer treatments on their fertility can be temporary. However, many men and women never regain their reproductive function. For these patients, sometimes we can still help them conceive following their cancer treatments, but it often requires the use of donor eggs or donor sperm. For breast cancer patients, the recommendation typically is to undergo surgery as quickly as possible, and then there's about a 6-week window following surgery until the initiation of their chemotherapy. And that's the perfect amount of time to do stimulation and egg retrieval. Even if the patients do not want to go through with fertility preservation, it's important for them to be counseled on what their options are. And that's what we as reproductive endocrinologists can do for them. Audubon Fertility has helped patients with recently diagnosed breast cancer by getting them in very quickly for a stimulation and egg retrieval so that they can undergo egg or embryo cryopreservation prior to their initiation of chemotherapy. Certainly we see plenty of patients with breast cancer that following their cancer treatment go on to use their frozen eggs or embryos and have a healthy baby. For cancer patients that are interested in fertility preservation, it's really important for them to be seen as quickly as possible by a reproductive endocrinologist. So we fast-track these patients, we offer them appointments same day or the next day, and have very little waiting times for these patients. We also, this is a really difficult time for these patients, so we also try to provide a very supportive environment for them. There's also the financial concerns for a lot of patients, and we offer significant discounts for cancer patients, and we can get all of their fertility medications covered through our partnerships with pharmaceutical companies. For a woman that undergoes either chemotherapy or radiation for their cancer, typically they have a depletion of the number of eggs in their ovaries. So this can result in menopause occurring much earlier. For women, the success of fertility preservation really depends on the age of the woman at the time that she freezes her eggs or embryos. So for younger women, the success rates are much, much higher. Eggs, embryos, and sperm can stay frozen for an indefinite period of time. For men who wish to preserve their fertility, the process involves sperm cryopreservation. And the success of this really depends on the quality of the sperm at the time it's frozen, as well as how he intends to use that sperm down the road, whether it be for intrauterine insemination or IVF. For women who wish to freeze eggs, it used to be that we would use a technique called slow freezing, and that resulted in a large number of the eggs not surviving the thawing process. Now we have a technique called vitrification, which has resulted in much improved success rates with freezing and thawing eggs. And this offers a great opportunity for patients who don't have a partner or who just object to embryo freezing for some other reason. Patients who wish to undergo fertility preservation can have the entire process done here in our clinic or at our Vivere facility next door. And the process takes about less than a month from start to finish. We freeze the sperm, eggs, and embryos at our Vivere Center, and they're kept in liquid nitrogen until the patient is ready to utilize them. We are very excited to be opening this Vivere Center soon, to have a place for patients with infertility to come to the uptown New Orleans area. We feel like we've put together an incredible team of experts, physicians, nurses, and we've really set this up to be a wonderful experience for patients. We're excited to be creating lots of babies in New Orleans.
So